Per the Texas Medical Association, Texas is the uninsured capital of the United States, with nearly 18% of its population being uninsured. That's 4.3 million people. Add to that 650,000 kids and the nearly 1.5 million folks that are unemployed, all without health insurance. You say, Deb, why is this important? It's important because we have a ways to go before this virus is fully contained. Yes, I heard May 1st is the deadline for everyone to start being vaccinated, and I also know that the government has had in place a plan for free testing that began in April of 2020. Now listen, drugstores usually have a sign out front that says, seniors, come on in and get your free flu shot. If you have health insurance, it's free. If you don't, it's $75 out of pocket. There seems to be nothing different in getting a vaccine shot. The Provider Relief Fund created by Congress is supposed to cover the cost of shots for the uninsured. Remember the $190 the ER was charging for testing? Getting vaccinated isn't free if the uninsured gets a bill for administrative costs. The administrative costs can be whatever a particular company wants it to be. Why do the uninsured have to come up with money regardless of the amount of the admin fee to be vaccinated? What's right or fair about that? Are the uninsured being given the same opportunity for life that those with health insurance are being given? Now, if you are uninsured and got a shot, I'd like to know how much your administrative charges were, if any. Put a number in the comments section below. Inquiring minds want to know. During this pandemic, a new term has been created, COVID long haulers. Long haulers are people experiencing symptoms of the illness many months or weeks later. If after recovering, they later need medications, then you know it's going to be expensive if an EpiPen costs $600, or if they need another stay in the hospital. How are they going to be able to handle that without health insurance? 30+ million people nationwide have been affected by the virus. Of that number, how many were uninsured? How many are going to need additional medical care? How many have been hit with huge medical bills after the fact and are now facing or suffering financial ruin that they may not be able to recover from, plunging them into or further into poverty? Just like the baby in the stroller, right is right and wrong is wrong. There's nothing right about this situation. It's totally all the way wrong. The bottom line, though, is we are all Americans, insurance or not. The chances of getting and receiving care for COVID or becoming a long hauler should not depend on if I have money or health insurance. Everyone has a right to life, whether some politicians think so or not. God the Creator, Buddha, Mother Mary, Allah, Gaia, Vishnu, or Shiva, or whomever you pray to said so. I have a right to exist, and the only one that has the right to make the decision if I live or die is the Creator, him or herself. If it's my time, it's my time. But don't get me wrong, I'm not saying I'm ready to go. I'm not saying that, but I'm just saying, the way things work. If it's my time to go, what can I do but go, right? But it's not my time because my elected officials don't want me to have primary health care to take care of myself, to live a longer, healthier life. The new administration has rejoined the World Health Organization, which is part of their 2030 Agenda for Sustainable Development. All countries have committed to achieve universal health coverage so those who need services can get them, and health care won't be only for those who can afford to pay for it. Now, to me, that says that this is a worldwide problem. And if it is, the U.S. needs to step forward and lead the world in extending human rights to its citizens by providing UHC. The United States needs universal health care right now, not in 2030. A lot of folks will be dead or dying by then. The government gives away $243 billion each year in indirect subsidies to the fast food industry. because they pay wages so low that we, the taxpayers, must come up with the $243 billion to pay for public benefits for their workers. What would happen if big business was no longer subsidized? Workers' wages were increased, and that $243 billion was allocated for universal health care. How is it that working at the biggest and wealthiest discount retailer in the world, and you still have to get welfare and food boxes? It wasn't that long ago. I remember. I know you do too. But Deb, you said we've got the ACA, Obamacare, Biden care, whatever they're calling it right now. But listen, Linda, listen. The ACA is a fabulous program. I've tried to get ACA in the past. I just couldn't afford the $400 or $500 a month or whatever it was. Now I see ads running saying instead of paying $1,400 a month, it'll only cost you $400 a month. Is that take $400 out of that $1,400 stimulus check and pay for health insurance for a month? At $7.50 an hour for 40 hours a week, that's $300 a week. Well, okay, wait. Let's say $225 after taxes. So that's $900 a month. By the time you pay rent, buy food, pay utilities, train, bus fare, or buy gas to get to and from work, and pay $400 for health insurance, it looks like someone will need another job or two. The ACA helps a lot of people, but there are those who still won't have basic health care or the ability to pay for it. And we're leaving illegal immigrants off the list. We're not going there right now. Let's talk about the additional 20 to 30 million people who will be without health care if the ACA is repealed. Universal health care is important so that everyone, regardless of economic standing, will be covered. UHC isn't just about, those who don't have health insurance. Many people with health insurance continue to struggle. Per an article in Forbes Online magazine in 2020, and I quote, more than 1/3 of households with health insurance, 38.2% to be exact, ended up with medical debt after an unexpected medical expense. The share of households with medical debt was especially high in Alabama, Kentucky, Mississippi, South Carolina, Oklahoma, Arkansas, Wisconsin, Missouri, and Idaho, where it exceeded 50%, end quote. The benefits, of UHC extend beyond just health and has a wider positive effect on society at large. When people are healthier, they can be more productive and active contributors to their families, their communities, and society at large. When people have less financial risk, families have less need to save for health costs and can spend their money on other things. Now, I really want to talk about saving that money for health care. I used to work at a company, and they offered a health savings plan. So let's say it started in January. So I decide I'm going to save $5,000 to cover any costs I may have, any medical emergencies I may have during the year, right? So now it's December 30th. I'm thanking my lucky stars that I haven't had any medical issues all year, and I'm thinking I'm a happy camper. I saved $5,000. Oh my God, I can put $5,000 in my savings right now. That's not right. Because this particular type of plan, if you hadn't spent all the money by December 31st, the money didn't come back to you or roll over to you. It went to the company you work for or someone else. Whoever it went to, you didn't get it. So to me, that never made sense. I never took advantage of that. That was not a win-win situation. Well, at least for me, it wasn't. It's amazing how the persons that we elected to do what's right for us, those whom we had faith in to put them in a position to earn $175,000 plus a year to enjoy their pursuit of happiness, that they would then have the audacity to turn around, stand in our face, and say loudly and clearly that an hourly wage of $15 is too much and that we, the American people, don't deserve health care. Now let's contrast that overwhelming figure of $15 an hour with the fact that the upper echelon of politicians earn $90 plus an hour. And they all did you hear me say all, A-L-L? They all have exceptional health care that we pay for. But let's take a closer look at boosting the cash flow in the U.S. economy, which is a good thing. Tom Balonovich wants to get away from the snow, so he takes his family to the sun for a week. He wines and dines his wife and makes happy memories for his kids. Tom is boosting the broader economy of another country. Michael, on the other hand, who's now making $15 an hour and can squeeze out a few dollars, and let me say that if you're making less than a congressman, senator, state rep, yada yada, etc., there's no such thing as extra cash or spare change. Michael wants to get up on a Saturday morning, put his family in a car, drive to Cedar Point, Magic Mountain, Six Flags, Detroit Zoo, somewhere. They spend the day hanging out at the park, check into Motel 6, let the kids swim in the pool, get up on Sunday morning, have a free breakfast, and take a slow cruise back home. Michael wants to make fun memories for his family too, and just because he's making $15 an hour doesn't mean he has health care, as some employers can pay upwards to $50 an hour on a 35-hour part-time basis, and the worker still doesn't have health care. Now, last on my list is Jose. Jose is only making $7.50 an hour. Cedar Point, Six Flags, Magic Mountain, the Detroit Zoo, or anywhere else is not even a thought. There isn't any money to spread cash flow in the broader economy. Jose doesn't have extra cash or health insurance. Jose's main concern is trying to make it through one more day. Depending on where you are in the country, if you were over 65, 75, or in a nursing home, you were qualified to get a shot. They got Medicare. If you were over 16 with special needs or pre-existing health conditions, you were qualified to get a shot. They have Medicaid, CHIP, or some type of health coverage. In some states, healthcare workers, not in Texas, were first in line and qualified to get a shot. They most definitely have health insurance. In some states, now everyone qualifies for a shot. Before this, however, I had one friend that works for a local city government who was quarantined twice and had to get tested both times. They had health insurance. I have another friend who works for a small business, and they also had to quarantine twice and get tested. They paid out of pocket. Both were qualified, one because of cash, the other because of insurance. Regardless of what state you're in, understand that I am in no way complaining that any of these people got COVID care. They all deserve to be tested and vaccinated. The vulnerable and the elderly have earned the right to be first. Now, healthcare workers, they needed to be tested first, vaccinated first. They had put their lives on the line for us each and every day for the past year, and they continue to do so every day, still. To me, that's the definition of a true hero, a savior, if you will. Where would we have been without them? I don't even want to think about that. But anyway, so no, I'm not being a hater because they got waited on before me. I want the best for everybody, but wanting the best for everyone includes you and me. For the many of us that don't have primary health care or cash in hand, we want to be tested, vaccinated, and live life like everyone else. As it stands now, per Dr. Fauci, a man of science and integrity, whom I trust, and I quote, by the time we get to June or July, that would be what I call, for lack of better wording, open season. Namely, virtually everybody and anybody in any category can start to get vaccinated, end quote. So to me, that means those without health insurance or cash money weren't qualified before. Yeah, he said free, but you didn't hear anything really about free on TV, did you? No, they are at the end of the line, the very last on the list, praying that they don't get the virus and die before then. And another question, why the word qualified anyway? What's up with that qualified? From the inception of testing and vaccinations, only those with health insurance were treated. Yeah, 65 and over. Everybody 65 and over has health insurance. The U.S. population is 330 million. So let's subtract 30 million that won't be vaccinated for whatever reason. That leaves 300 million to be vaccinated. Out of that $300 million, we're going to take $250 million at $100 a shot, and that equals $25 billion. I subtracted from that 300, I subtracted 50 million, and that 50 million will stand for the uninsured. So 50 million uninsured at $50 a shot is 2.5 billion. But we're going to add another 2.5 billion in administrative costs charged to the uninsured for a grand total of the 300 million vaccinations to be 30 billion for shots, and I would imagine a total for testing to be 30 billion or so, for a total of $60 billion. So some CEO says, now look, I want to start making money real fast. We can't do this for free. We're not going to do it for free. Not when we can get paid. Let's do everybody over 65 and we know we'll get paid, right? They got insurance. Now, getting money from a turnip or the uninsured may be like pulling hen's teeth. We'll leave them for last. And please, don't anyone yell free till we're almost done. That's probably what they said, because as far as I'm concerned here in Texas, free vaccinations, they weren't saying that. They were just saying if you're qualified, come and get your shot. They didn't say anything about being free. The drug companies got paid, hospitals, clinics, whoever were giving out shots, taking tests, doing testing, they all got paid. Is health insurance the divider and the qualifier between those who got tested and vaccinated first and those who didn't? I'm just asking for a friend. It is with deep, heartfelt gratitude that I thank you for joining me on this journey of growth and transformation. Being without primary health care can be a scary and stressful situation. But Deb is here, and together we can work it out to get and keep you in tip-top shape. Don't worry about a thing. I don't want anyone in their home gambling with their life because they don't have health care or cash to take care of themselves. Universal health care is mandatory now. I will continue to advocate for primary health care and for everyone to keep them strong and healthy. Hit the like button if you'd like to support this channel. Hit the little red subscribe bell if you want to be notified when the next video is uploaded on herbal remedies, tips, and tricks. Share this video if you know someone that it would interest. Our website is currently under construction, but you can go to empoweredge.org and sign up to get notified when it's up and running, and you'll also be notified on the launch of our newsletter. Feel free to leave a comment below, as I would love to hear your thoughts, ideas, suggestions, or questions on herbal remedies. Know within yourself that all is well, and so it is. Check out the last video in this series, All Us, Part 5. Until we meet again, wishing you all health, light, love, and peace. See you in the next video.